Well, good afternoon. I am sitting here in very sunny Berkeley, California. I have with me Laura Janisse, who's working with the Innovation Learning Network as one of their chief designers. So Laura, just tell us a little bit about your background and how you found yourself within healthcare, particularly healthcare and design.
Sure. So I am a designer by trade. That was my undergraduate focus. And I decided to go back to school to pursue my graduate degree in design. And the summer before I started graduate school, my mother was diagnosed with cancer, and I ended up spending a lot of time in the hospital that summer. And it was my first time. I mean, luckily I didn't spend much time in, that environment as a child growing up. So it was a first time I spent a lot of, time in that type of environment. And so, having kind of entered the design world, it was, I was looking at it through this design lens, and it was just astonishing to me how much potential I saw for, positive impact that design could have. So when I went into my graduate studies, I had, a very focused kind of intention to try and explore the intersections between design and healthcare, and I wasn't really sure what existed at that point. So with some exploration, I ended up coming across innovation consultancy at Kaiser Permanente, where I ended up interning, and that gave me kind of real-world ground experience about how design can, really be integrated into the healthcare context. Mm-hmm. So that's my background, and that's kind of how I ended up in healthcare. And when you see how much design can influence and impact the healthcare space, it just becomes, for me, it just became an immediate, passion. Yeah. And so I've always loved working within the healthcare space.
Yeah. And that's interesting because, when you think about design, particularly when you think about sort of some of the more modern design, you don't really associate it with healthcare. Healthcare, you look at a lot of the traditional software, it's very clunky and not user-friendly. How has the reception been from your perspective or from your experience of some of these design concepts into the healthcare space?
Well, it's a good question, because I think a lot of times healthcare companies might have a technology they want to implement, but then they don't necessarily know the best way to go about it. Mm-hmm. The angle that I have always practiced from is using a very human-centered one, and so that's going into the healthcare world with fresh eyes, not necessarily knowing what the particular solution is, mm-hmm. and starting with really understanding the users, their true needs, what their aspirations are, what their daily lives are, and really from that qualitative research, really better understand, what is it that we need to design to meet that particular solution. Mm-hmm. So within healthcare, I've seen a lot of technologies be implemented and then going backwards and saying, okay, well, how can we make this more user-friendly, or how can we help this, be a sustainable solution? So I've come at it a different angle, really, but I think one of the key things is always to involve and engage the user at every point of the process, whether that's in the research phase or the ideation phase or prototyping. Even after something's been spread, I think always engaging the users will give you instant feedback. They become your advocates, and they really. I think one of the key things is helping to create ownership amongst the users. So because when it becomes their thing, they're more inclined to figure out how to make it work, and keep it around.
So what was the delta that you saw when you first got into the healthcare space as a designer between what you knew or what you've learned as kind of an ideal path, or as kind of a positive path towards developing products or developing services, and what you actually encountered when you got there?
Okay, well that's a so I prior my work at Kaiser Permanente, I was at IDEO, and so I worked very much in the consultancy space where projects were really fast, and you worked very quickly, and oftentimes you would leave a healthcare client at the when the solution had been realized phase, and you didn't get a lot of exposure to what happens to this, when the company tries to actually implement it and sustain it. So a lot of what I encountered coming into the healthcare space was really understanding how much time coming up with an idea, a sustainable idea, takes. The tail end of the innovation process. What does it mean to really have an idea successfully spread? So I think I was shocked with potentially how much time things took, the level of engagement really needed after you come up with that idea, that solution. And I think continuous education was also key. When you're living and breathing design and you enter the healthcare space, you encounter a lot of people who aren't, designers, obviously, and think very differently than you, which is great and awesome because it makes for, really powerful conversations. But I think a lot of what our work entailed was around, educating people about why we do what we do, to really help them get on board. And oftentimes they end up becoming the biggest advocate for this, human-centered approach, human-centered design within healthcare.
Yeah. So you're really talking about, it's almost the change management. It's not just the design, but it's also helping people on the provider side, not just on the patient or the consumer side, embrace the solution and kind of become champions.
Yeah. I mean, we're designing for humans.
Yeah.
So we have to understand them on a human level, or else, it's going to be a very difficult road. And it's a difficult road anyway, even when you are engaged with them. So
yeah. So I mean, it sounds like really obvious things, but even to this day, we still have a lot of issues around that with healthcare. What are some of your thoughts around sort of why we're still struggling to adopt some of this kind of sort of human-centered design approach, sort of at a broader scale?
I think it's hard to. I think it can be hard to provide for people to understand. I don't want to say ROI, but I think a lot of decisions are made based off of that type of information. And I think when you're coming from a very qualitative human, place, it takes a lot to help people understand the value of that. So, I think it takes, one is time, one is, how can we help, and this is, the challenge for designers is how can we help people really understand the value of it. And I think, sometimes that gets really messy.
Right. Okay. So it's really almost like a conflict between respect for qualitative data or qualitative inputs when you're in a sort of an evidence-based, quantitative type of environment.
Right. They're evidence-based. Kaiser is an evidence-based organization, and so, a lot of the work that we did was to really work hard on providing that evidence in terms of our work and the impact that it made within the organization. We obviously were able to. It was, it's a very successful stream of work and group within the organization now.
Yeah.
So that's a great thing.
Yeah, thanks to your work.
But
of course.
It's hard.
Yeah.
It's hard.
So switching gears a little bit, I want to talk about some of the projects that you worked on where you kind of got that that sort of real experience of some of the concepts you talked about of the change management, of getting people to buy into the qualitative approach, and then also going not just from developing the solution, but then also from the implementation. Can you speak to maybe one or two projects that you can kind of point to as good touchstones?
Yeah, I'm trying to think what would be public versus what needs to be. I guess I didn't particularly work on this project, but it's a project that the group worked on. that I was exposed to, obviously, but nurse knowledge exchange is a great example of a solution that was kind of redesigning nurse communication at shift change.
Mm-hmm.
And, that was a project that had several kind of iterations to it, which I think is also really key to understanding, to understanding that you need to allow yourself to evolve and be flexible as people's needs change, and when you learn more as time goes on, how can you adapt those solutions or make them better?
Mm-hmm.
So that project was anchored in human-centered research, really getting in there and understanding what happens at shift change, how are people, what is the communication, how does the patient feel, and taking that information, and then the team came up with a redesign of that communication at shift change and involving the patient in the conversation. And so that is a solution that ended up getting spread throughout Kaiser Permanente, and but it's ongoing. So when I was there a few years back, we were partners. We considered ourselves partners with the managers who were supporting this initiative and work within the hospitals. And I think that's really the best word is really, it's all about partnership and staying with people, checking in, being support, helping them educate other people, so that they develop advocates and support that they need to keep things sustainable.
Yeah.
So that is one project. Another project that I worked on specifically is called KP MedRight, and that was around medication administration. And again, we went in from a human-centered perspective, spent time with nurses, and tried to understand, the safety around medication administration. And if you Google KP MedRight, you can read more about it. I won't get too detailed into it, but I think when you go into these projects, you're not necessarily sure what the solution might be.
Mm-hmm.
And in that case, we prototyped various, kind of a portfolio of different ideas in order to really understand what the correct, thing not correct, but what was going to work best for the users in that space at that point in time.
Okay.
So, sorry. So keep asking me questions to make sure I'm on track here.
Yeah. No, so I mean, and obviously from the success both of your group, which has kind of grown and grown, as well as with ILN, there's clearly commitment to making the change and to adopting some of these human-centered design principles. So what can you speak to what people can do in the broader healthcare community to maintain this kind of momentum that's positive, that's growing, that's starting to be more aware of this definitely more aware of being more responsive to the specific needs of patients?
I think being really open-minded to trying new things is huge.
Mm-hmm.
Oftentimes we go into a space and, people are busy. They have their jobs. They have things that they have to do before they go home. Patients have their lives they're living. And I think, from the healthcare provider's point of view, being as open-minded and, explorative as possible, I think is really key. I think the hardest moments sometimes are when you go in and you have, team members or people that you're trying to work with on the floor that have more of a closed kind of mindset. They feel the challenge is too much, or it's I guess no one wants another thing to think about. No one wants another, project. And so, being empathetic to their world from the designer's point of view, I think is really, really important, because otherwise you're never going to connect with them.
Yeah. That makes sense. So any last parting thoughts of wisdom to the world as we wrap up?
Oh gosh. Well, I mean, I honestly am so appreciative that the healthcare, world is a space that I've been able to work within. So, thanking everyone who's allowed that to happen. But, I think it's really exciting. I think healthcare, has been changing and will continue to change based off of growing needs that we all have. And I think it's a really exciting time to be within the healthcare space. So I don't know. I think just continuing to push the boundaries and continuing to think what's possible instead of falling back on focusing on what can't be done is really important.
Yeah. Well, thanks for your time, and as always, it's good to hear for what you have to say. I've learned a lot from you, I know personally, around design and being more appreciative of the qualitative aspect of of all things. So thanks again for dropping by, and
yeah. Thanks for having me.
Yeah.